Hello everyone. Today we are going to discuss a new topic that name is anti-anginal drugs. We could say about it the drugs used in ischemic heart disease. Actually, angina pectoris is a symptom of ischemic heart disease. Angina is caused by an accumulation of metabolites in the striated muscles and is associated with severe chest pain that occurs when the coronary flow is adequate to supply oxygen required for the heart. Actually, ischemic heart disease is a common cause of death across the world. It may manifest as angina pectoris, unstable angina, and in more severe cases as myocardial infarction. Actually, myocardial infarction is a medical emergency. A heart attack usually occurs when a blood clot blocks blood flow to the heart. Without blood, tissue loses oxygen and dies. Angina pectoris is the chief symptom of ischemic heart disease, characterized by sudden, severe, substernal discomfort or pain, which may radiate to the left shoulder and along the flexor surface of the left arm. Okay, a large percentage of the patient may not experience pain as such but may have substernal discomfort or suffocation or uneasiness. Okay, actually angina pectoris is a term which means is angina pectoris is a referred pain that result from the anoxia of a cardiac muscles. Next term is myocardial anoxia may be caused by a number of factors. They are ischemic anoxia, occlusion of the coronary vessels due to thrombosis or spasm of the vessel. Next one is anemic anoxia, anemic condition. Next one is functional anoxia, that means is oxygen demand of the myocardium not met by increases in coronary blood flow. Insufficiency in coronary circulation imposes strain on health and function of the heart. This leads to anginal or substernal pain. Actually, chest pain which radiated down the left shoulder and arm. The principle of the therapy for the angina, that is mainly three type of the anginas. Number one is classical angina, that means is pain is induced by the exercise or emotions, both of which increases myocardial oxygen demand. In such patient that there is narrowing of coronary arteries due to atherosclerosis and therefore the coronary cannot dilate, the increases the blood supply during exercise. Okay, hence them is an imbalance between oxygen supply and demand. Next one is variant angina. It occurs at rest and caused by the spasm of the coronary artery. Next one is unstable angina, a combination of the factor that increased the myocardial oxygen demand. Okay, and some coronary vasospasm and platelet aggregation may be result in angina called unstable angina, which required immediate treatment. Now come to the principal therapies of the angina. Pharmacological therapy to prevent the myocardial infarction and death. Give antiplatelet agents, that is aspirin, clopidogrel. Next one is lipid lowering agents. Gives AC inhibitors to reduce the risk from coronary artery disease. It increases O2 supply, restore the coronary blood flow by PCT, percutaneous interventricles, including stenting, coronary artery bypass grafting. The classification of the drugs which is used to be control the ischemic heart diseases, that is number one is nitrates and nitrites. Amyl nitrite, example of the drug is nitroglycerine, amyl nitrites, pentaerythritol tetranitrate, isosorbide nitrate. Next one is B adrenergic blocking agent, that means beta adrenergic blocking agents. The drug examples are propranolol. Next class is calcium channel blockers. Number one is 1,4 dihydropyridine and B category is diphenyl alkylamine. Next category is actually calcium channel blockers are subcategorized into the four portions. Number one is 1,4-dihydropyridine. Next one is diphenyl alkylamine, benzodiazepine derivatives, and diamine propanol ether. Next, their example of the drug is amlodipine, felodipine, nifedipine, nimodipine, nicardipine. Next one is vezapamil, diltiazem, bepiridil. These are the drug examples which comes under the calcium channel blockers. Next is the miscellaneous class. Miscellaneous, the drug example is dipyridamole and aspirin. This is the classification of the anti-anginal drug and the introduction about the anti-anginal drug. Hope you understand about the anti-anginal drugs and their classification and some terms which is used as a therapy of the angina. Thank you.